Hello everyone, I'm taking an informational video that gives you an idea what I did exactly in surgeries. Enjoy it. She came to me to have some definition for the nose. Very beautiful face, but the nose proportional looks a little bit wider, especially while smiling. Nose flares to sides, a little bit much for her. And in the side view you can see the bump, and this view it looks very nice. There's a little hump here. There are two depressions on the nose. We want reduction here and augmentation at this part, but at the same time to give it projection we need to a little bit rotate the tip in upper position, and we want to make it strong. And after doing this, I make with recapitalized grafts overall higher ridge, overall projection, since she wants some significant change but still want to look natural. And from the base view you can see the nostrils a little bit flat. In this video you can see how nose support is weak in the tip part, so you cannot understand this with photograph. For treatment which gives us less flaring when people smile, we need to make a good support with recapitalized graft on this kind of case. From the front view, this is 2 months after surgery. We performed closed rhinoplasty for this patient. As you see the augmentation effect, the nose starting point is in a higher position. It was starting on this level, and it's starting like an upper eyelid crease area. And this augmentation gives much definition. And the tip part lifted, you can see this distance from the nose to lip, upper lip, better, but still natural. And the nostrils look round. But still early, and you can see some clear swelling, signs of swelling. And this photo is showing what we did. Reduction on the bridge, this hump, but overall augmentation for the bridge part of the nose. So basically the nose overall starts in a higher position, but we get rid of hump. This is a very good example. And the lifting of the tip is in a neutral position, looking very natural. And from the base view you can see the improvement with time is improvement of the nostrils. Of course it's very important. There are a lot of natural differences, asymmetries for the nose. Also the nostrils, here, this part, skin thickness. So it's normal to have some asymmetry after surgery too. This is very important. Please do not obsess about this. What we did for this augmentation, we can see in this animation. This is a fascia which we take from abdominal muscles by an incision under the breastbone, and we diced recapitalized graft. Then we create a strong fascia graft. It's a little bit different than the traditional grafts. It gives support, strong support to bridge, and cause this kind of augmentation, results with this kind of projection change. And after 2 years, you can still see the effect of augmentation. The nose is starting in a higher position. But the advantage of these fascial grafts, it doesn't create good sharp edges like solid grafts. And when I see from my practice, the complications are less and more manageable. And for the tip part, you can see the lifting effect. It's in a very natural proportion and smaller, but not very sharp or like fake look or triangular look. And side view, after 2 years, you can still see this projection and rotation is very nice. New bridge looks very soft and beautiful. And from other angle, you can see it. It's looking so much proportional actually with the face. I want to tell last thing about these rhinoplasty results. Our anatomy naturally is very different from each other. Skin thickness, bone anatomy, cartilage structures are very different. We change the proportion of the nose with relation to face. So if you want a rhinoplasty, primary, more important point is to have a result with proportional with the face. Instead of focusing too much detail as a person, it's good to focus on that proportion, on that perception, that change. For example, it looks like a more softer. Look the side view, it looks softer. It's look better in proportions. That's the part that we need to focus. And if you are happy with that kind of change, I recommend you to have rhinoplasty. If you are so much obsessed about so much details, which I already obsessed, but because of the nature, there might be some imperfections, especially at this kind of surgery, I recommend you not to have surgery. If you have surgery, it's good to have a surgery with a doctor who has surgeon who has a lot of experience with these kind of cases. And especially with these natural changes, our patients feel so happy after surgery. Thank you.